syphilis, this lesion is called gumma. This is a gumma, and this is another one. This is the reason why we call this gummatous syphilis. This is one of the most severe manifestations of syphilis. So tertiary syphilis is the most severe. Even patients with primary syphilis or secondary syphilis, they may suffer central nervous system invasion, but most times this central nervous system invasion is asymptomatic, most times. So this is a picture of syphilis. This is a picture very simple about syphilis that you will study in more detail in internal medicine. About 11 million people infect every year of syphilis in the world. And the problem are pregnant women, as we will see later. The transmission of syphilis is through sexual contact. But we have another problem. Another problem with syphilis. The transmission of Treponema pallidum is also possible from mother to child, so vertical transmission. Not common now, but it was very common in the past. If a pregnant woman becomes infected, the pregnant woman can transmit the disease to the fetus, transplacentally. And the fetus may suffer a severe disease, and also the newborn. That is the problem. So what happens when a pregnant woman becomes infected? Transmission to the fetus, and the fetus may be born dead. That's called stillbirth. If not, the newborn may suffer severe malformations that I will show you now. Malformations like Hutchinson's teeth, or saddle nose, or short maxilla, or protuberant mandible. These are Hutchinson's teeth, or this. This is a saddle nose. By the way, this is a saddle. The shape of the nose is like this. In this picture, you can see 3 malformations of a patient with congenital syphilis. You can see the saddle nose. The saddle nose. You can see the short maxilla. Short maxilla. And you can see the protuberant mandible, the chin here. This picture is very old. Currently, congenital syphilis is not common, fortunately. This is the problem if a pregnant woman becomes infected. So, the exposure through the exposure to Treponema pallidum may be through different mechanisms. The most common, sexual transmission. The second, congenital transmission from the mother to the fetus. The diagnosis of syphilis is very difficult because we can't grow Treponema pallidum in laboratory. It doesn't grow. The diagnosis is made by serology. And this is very important, but unfortunately, we don't have time to explain this in detail. Just to tell you that we have 2 types of tests to detect antibodies in the patient. We have non-treponemal tests and treponemal tests to test. Non-treponemal tests are cheaper, but they are less specific and less sensitive. Treponemal tests are more specific and more sensitive, but also more expensive. For the diagnosis of syphilis, we usually perform 2 tests, one non-treponemal and one treponemal. I hope that you study this in detail in infectious diseases, because we have many, non-treponemal and treponemal. The treatment of syphilis is penicillin. All stages of syphilis primary, secondary, latency, and tertiary, all of them are treated with penicillin. Penicillin is the treatment of choice for all of them. And we are going to finish the class with Leptospira interrogans, the other spirochete that we are going to study. With one difference. Leptospira interrogans can grow in culture. Treponema pallidum cannot. So, Leptospira interrogans. I am going to try to explain using the whiteboard. So we have studied Treponema pallidum. Treponema pallidum is the agent of syphilis. Syphilis is a sexually transmitted disease. We are going to study now Leptospira. Leptospira, the most important disease, the most important species is interrogans. Leptospira interrogans. And this is common in Southeast Asia. We can find Leptospira interrogans in Vietnam. The name of the disease is leptospirosis. Leptospirosis. Leptospirosis is a zoonosis. You already know the meaning of zoonosis. It's a zoonosis in rodents. A zoonosis is a disease in animals that may be transmitted to humans. Mostly rats. So rats become infected with Leptospira interrogans. And what happens to the rats? Many times nothing. So rats may remain asymptomatic. And some rats will suffer disease. The disease in the rats infects the kidneys of the rats, okay? So the bacteria, Leptospira interrogans, Leptospira is released in urine. So the urine goes to the environment, the infected urine. And this infected urine in the environment is going to contaminate the water. And this is the reason why humans become infected. Because humans contact contaminated water. Humans get infected through inoculation into the skin or mucosas. This is the typical person who goes to swim or to take a bath in a lake contaminated with urine from rats. And this urine contains Leptospira interrogans. So I hope you can follow the process from the animal, from the rat, to the humans. Humans become infected because they enter in contact with infected urine. And what happens in the humans? The humans suffer the disease. The disease is called leptospirosis, that you will study in detail in the future. Here, we are going to say very few words about leptospirosis, because you will study later. At the beginning, leptospirosis is very mild. It's like a flu. It's flu-like, very mild. And many patients stay here. Many patients have a mild disease like this. However, in some patients, the disease may become more severe, more severe, invasive. In patients more severe, these patients may show meningitis.